So the objective of the study was to see whether flexible blue light cystoscopy resulted in an increase in detection of non-muscle invasive bladder cancer, particularly CIS, and to see whether the repeat use of Cysview was safe in this setting. So the objectives of the study were met. We definitely saw an increase in detection of both papillary tumors, additional tumors seen in about 40% of the patients. There was an increase in detection of carcinoma in situ in the outpatient setting with the flexible blue light cystoscopy with Cysview. Also, as part of this trial, one of the important aspects was looking at patient-reported outcomes, seeing if the repeat use resulted in any adverse outcomes, and that objective was met as well. There were no increase in adverse outcomes with repeat use. This was a study done at 17 sites in the U.S. It was a prospective study within patient-controlled prospective study. And basically, patients underwent a flexible cystoscopy with white light first, and then we switched to blue light. These are patients who obviously had Cysview instilled prior in the clinic setting, and then we examined the bladder again in blue light. Those who had suspected lesions or tumors seen were then taken to the operating room per study protocol. So we had 304 patients initially that underwent the white light cystoscopy, 103 of which ended up going to the operating room for further analysis. Within those patients, 63 were found to have confirmed tumors. This was confirmed pathological tumors. This was highly statistically significant increase in detection of tumors seen with the blue light. The other thing that was very significant, it was that of the patients who were found to have CIS, 9 of the 26 patients were discovered by blue light alone. So again, it increases our ability not only to detect additional papillary tumors, but certainly an increase in carcinoma in situ as well. High-grade lesion, again, something that we want to address earlier in the disease process. So another important aspect of the study was that we had to wait a minimum of 6 weeks before installation of Cysview for evaluation under blue light for patients who had undergone BCG therapy or any intravesical therapy. That's perfectly in line with what we do in clinical practice. Previously it was thought perhaps we need to wait 90 days or 3 months to let the inflammation settle down to decrease false positive rates, but fortunately we saw that 6 weeks was really an adequate time to wait, and it did not increase our false positive rates with patients who had undergone intravesical therapies. So that was important because it's perfectly in line with what we do in clinical practice. So of the patients who went to the operating room, there were 100 patients that went to the operating room. 63 had tumors detected that were confirmed by pathology. So white light did not detect these lesions. That's 21% of the lesions were found only by blue light cystoscopy. A significant, like I mentioned before, a significant number of these were CIS patients, and those were detected with the blue light only.